What causes hematuria if you have radiation cystitis? Imagine your bladder as a stretchy balloon that holds urine, but when radiation therapy is involved, things can get a bit complicated. Radiation cystitis is an inflammation of the bladder caused by radiation treatments in the pelvic area, often used for cancers like prostate, cervical, or bladder cancer. One common symptom that can worry many patients is blood in the urine, known as hematuria. But what exactly causes this bleeding? When radiation is directed at the pelvis, it doesn't just target cancer cells. It can also damage healthy cells lining the bladder, called the urothelium. This damage makes the lining more fragile and prone to bleeding. Over time, radiation can also cause scarring and narrowing of the tiny blood vessels in the bladder wall. This process is called obliterative endarteritis, where blood flow to the tissue is reduced, leading to less oxygen and nutrients reaching the bladder tissue. As a result, the tissue becomes thin, weak, and more susceptible to injury. In response to this poor blood supply, the body may form new, fragile blood vessels to try to compensate. These new vessels are often more prone to breaking and bleeding, which can cause hematuria. In some cases, the damage is severe enough that ulcers or sores develop on the bladder wall. These ulcers can bleed and contribute to the presence of blood in the urine. The amount of blood can vary widely. Sometimes only a microscopic amount of blood is present, which can only be detected under a microscope. Other times, the urine may appear pink, red, or even contain blood clots, especially if the bleeding is heavy. Hematuria can occur during or shortly after radiation therapy, known as acute radiation cystitis, or it can develop months or even years later, called late or chronic radiation cystitis. Severe bleeding can lead to complications like anemia, where the blood count drops, or urinary retention caused by blood clots blocking the flow of urine. Managing hematuria involves addressing the inflammation and controlling the bleeding, sometimes through medical procedures or surgical interventions. If you notice blood in your urine after pelvic radiation, it is crucial to see a healthcare professional promptly. They can evaluate the cause, determine the severity, and recommend appropriate treatment options to help manage symptoms and prevent further complications. Remember, each person's experience can be different, so personalized medical advice is always essential.